Welcome to our 5 on 5. Pleased to be joined today by Dr. John Kolsbun, the Senior Medical Director for AllCare Health. Good to see you. Thanks for being here.
Thanks, Craig.
So we're talking a lot about something you guys deal with as a CCO, AllCare Health, chronic pain and the opioid problem in the state of Oregon right now. What are some of the issues that you see with people dealing with pain?
Well, one thing I just want to talk briefly about the different types of pain. We've got acute pain, say somebody breaks their arm or their leg, they're going to need medication for that. And post-operatively, they have surgery, they're going to need something. Then you've got the patients who have cancer and need to be treated for quality of life issues. But then you've got a big portion of people who have daily chronic pain. And that's what we wanted to address. These are folks who maybe because of their pain, because of the therapy that we're giving, may be unemployed, may be losing out on activities that they used to have pleasure in, and pretty much socially isolated.
Okay, and why now? I mean, people have been dealing with pain for a long time. Why is there such a strong effort to decrease the types of powerful medications today?
Well, I think that a lot of this is driven by recent information. We've learned important things, such that these pills are much more powerful and not as safe as we once believed they were. We know now that we're going to have to pull back on the amount of opiates that we prescribe just for patient safety. Other very important information that's come to light lately is a big landmark study. They actually had patients who were receiving opioids for 3 months for their chronic pain. And at the end of that time period, they didn't fare any better or actually had worse outcomes, worse pain, than patients who didn't receive opioid medications during that time period.
Wow. Okay.
And certainly the side effects. A lot of people are bothered by sleepiness. They may sleep anywhere from 16 to 20 hours a day. They are hazy. They can't think well. They're prone to falls, maybe motor vehicle accidents. And so the more concerning things are when you get into addiction and issues, and what we've seen in Jackson County recently with the unprecedented amount of opioid-related deaths.
Yeah, indeed. Okay, very good. We're going to take a quick commercial break. We'll have much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with John Kolsbun, the Senior Medical Director of AllCare Health. So we're talking about pain management and opioids and the dangers that they pose in our community. How have CCOs helped address the issues around chronic pain and patient safety?
Well, I think one of the most important things we've learned is to get everybody in the same room communicating so that we know what other systems are doing, so we can get inefficiencies out of the system and give the best treatment to the patient that we can. We have a unique situation down in this Southern Oregon area. We've had 4 CCOs, coordinated care organizations, that have come together. We are working on educating providers with regular meetings, regular monthly educational meetings. We're working on educating the patients and the community. With this, one of the things that Oregon Pain Guidance, a group that is local, and KOBI is working on in the last couple of years are public service announcements. Recently, during the Olympics, you might have noticed that the new PSAs were running about naloxone and self-empowerment, how patients can help control their own pain. So out of the KOBI affiliation, we developed the Stay Safe Oregon website. It was apparent that we didn't have information available out there for patients to access. So we have a website. It deals with up-to-date, real-time local and regional resources, helps with education around pain, how to best use nutrition, movement, mood improvements, and sleep enhancement to help with the chronic pain. And one last resource that we consider very valuable and that you know very well is Julia Pinsky with Max's Mission, a woman who's dedicated her life now to getting naloxone or the opioid reverser out to communities as well as first responders and doing the training with them.
Yeah, there's a lot going on, and it's great to see that everybody's working together, as you said, to correct inefficiencies, to paraphrase. So what would you recommend for people who are watching at home? What can they do to learn more or to get the word out, if you will?
Well, I just want to emphasize that it's not too late, that there's help out there. We want to teach patients to to live with their pain rather than being a prisoner of their pain. So as we've talked about, the Max's Mission website, the Stay Safe Oregon website, and I would encourage patients to talk to their provider, talk about realistic expectations about their pain management, talk about alternative therapies, talk about coming down or eliminating opioid dosing if they have it. Also would encourage folks to contact their insurance plan. If they have the CCO or commercial plans, we're all involved in this, we're all tackling the problem. They have resources for movement, for nutrition, and peer-to-peer, such as Living Well with Chronic Diseases. Very good programs that can help people work with their own pain.
It's good that they're out there. Excellent. Thank you for
Absolutely.
being here. Appreciate it.
Craig, thanks.
All right. Stay with us. We'll be right back.